Pulmonary ventilation is the process of breathing, encompassing both inspiration and expiration. It allows for the exchange of oxygen and carbon dioxide between the air and the blood. This process is driven by pressure differences created by the diaphragm and intercostal muscles. Understanding pulmonary ventilation is crucial in medicine for diagnosing and managing respiratory diseases. It ensures oxygen delivery to cells for energy production and removal of carbon dioxide. Disruptions can lead to respiratory distress and failure. Breathing is driven by pressure changes within the thoracic cavity. During inspiration, the diaphragm contracts and flattens, while the external intercostal muscles lift the ribs. This expansion decreases intrapleural pressure, allowing the lungs to expand. Expiration is largely passive. The diaphragm and muscles relax, decreasing thoracic volume. This increases intrapleural pressure, causing the lungs to recoil and expel air. Lung volumes and capacities are measures of respiratory function that quantify the volume of air associated with different phases of the respiratory cycle. These measurements are essential for assessing respiratory health, diagnosing respiratory diseases, and monitoring the effectiveness of treatments. Spirometry is a common pulmonary function test used to measure lung volumes and capacities. Key lung volumes include tidal volume, the amount of air inspired or expired during a normal breath. Inspiratory reserve volume, the maximum amount of air that can be inhaled after a normal inspiration. Expiratory reserve volume, the maximum amount of air that can be exhaled after a normal expiration. And residual volume, the volume of air remaining in the lungs after a maximal expiration. Lung capacities are derived from these volumes and include inspiratory capacity, functional residual capacity, vital capacity, and total lung capacity. Section 4. Clinical correlations, COPD and asthma. Understanding pulmonary ventilation is crucial for diagnosing and managing respiratory diseases. Chronic obstructive pulmonary disease, or COPD, and asthma are two common respiratory conditions that significantly affect pulmonary ventilation, albeit through different mechanisms. COPD, an umbrella term encompassing emphysema and chronic bronchitis, is characterized by persistent airflow limitation. This limitation arises from a combination of airway narrowing, often due to chronic inflammation and mucus production, and loss of lung elasticity, leading to air trapping. In contrast, asthma is characterized by episodic reversible airway obstruction due to airway hyperresponsiveness, inflammation, and mucus plugging. These changes in airway caliber and lung mechanics in both COPD and asthma lead to impaired airflow, reduced lung volumes, and respiratory distress. Section 5. The importance of pulmonary function tests. Pulmonary function tests, or PFTs, play a crucial role in diagnosing and monitoring respiratory diseases. These tests measure lung volumes, airflow rates, and gas exchange, providing valuable insights into respiratory health. Spirometry, the most common PFT, measures the volume of air a person can inhale and exhale and the rate at which they breathe. PFTs are essential for diagnosing obstructive lung diseases like COPD and asthma, which are characterized by airflow limitations. They help assess the severity of the disease, monitor disease progression, and evaluate the effectiveness of treatments. PFTs can also identify restrictive lung diseases, characterized by reduced lung volumes, such as pulmonary fibrosis and obesity hypoventilation syndrome. In clinical practice, PFTs are valuable tools for early disease detection, risk stratification, and treatment optimization, ultimately improving patient outcomes. Section 6. Conclusion. Pulmonary ventilation, a vital sign. Pulmonary ventilation is a fundamental physiological process that ensures the continuous exchange of oxygen and carbon dioxide, essential for life. Understanding the mechanics of breathing, lung volumes, and capacities is crucial for comprehending respiratory health and disease. Clinical conditions like COPD and asthma highlight the significant impact of impaired pulmonary ventilation on respiratory function and overall well-being. Pulmonary function tests are invaluable tools for assessing respiratory health, diagnosing diseases, and monitoring treatment effectiveness. As healthcare providers, a thorough understanding of pulmonary ventilation is paramount for diagnosing and managing respiratory conditions effectively, ultimately improving patient care and quality of life.